So I'm a lawyer by training. My company in Australia had recently opened an office in Singapore, and I was sent up there to work for 2 or 3 years. And Jane and I were at home, and I was trying to work out the new computer, and next thing I knew, I woke up and I was in hospital. So what had happened is that I had had a seizure, and it was determined reasonably soon after that that the seizure had happened because I had a brain tumour, a glioblastoma 4, and which coincidentally my father had died of. So when I passed the information on to my family, there was a fair bit of ruction going, oh no, not another one. So that was a bit of a shock. April the 12th, 2014, so it's a reasonable time, and continues. I don't know what the outcome will be. I've had 2 operations, one in 2 craniotomies, one in Singapore when it was first found, when the surgeons in Singapore decided to go in and take it out, and a second operation here in New South Wales, which is charmingly called debulking. And because I had become quite sick at one stage and medicines weren't working, and I was nauseous and not well at all, and I think that was probably leading up to the second operation. And I spoke to my sister who lives in Melbourne, and she said, you need to find someone to come and look after you. It's not enough just to be going and seeing your oncologist. There's a lot more needs to be done. And so like everyone, you still think palliative. No, I'm not ready to die, thank you very much. And I was reminded as soon as this happened that no, it's about general care of people who are having significant physical problems, significant disease, etc., and that it's about making sure that you are comfortable and keeping an eye on you as a whole patient. First of all, we were delighted because you get a bit on your own for a start, so you're delighted that there's someone who is caring and who comes and kind of says, how are you and where are you at? So you don't, first off there's a sense of relief because you know there's someone else on this rather difficult journey with you. It's not just, Jane and I sitting there.
When we did have the first introduction to the team, it was just at the time when he was at his sickest and he had a stint in hospital. And I was able to ring the nurse and speak to her about it, and she could give me advice about what I should do. And then when he was vomiting and really sick, I was able to ring that 24-hour number, and so they said, get up to the hospital, we'll ring them, we'll tell them you're coming. So that for me was just priceless.
We were delighted to be immediately in the hands of people who knew what they were doing and had a kind of holistic view of the care that you might need.
Every time we've had a visit, we haven't even understood that we really had questions that we needed to ask, and then because they quietly sit and ask how things are going and we discover that there are questions that we have, and they've been very good at recommending ways of managing nausea and also managing the ulcers in his mouth and things like that. So it's been a huge support and comfort to have that.
I'm not particularly fearful at the moment. There are times when you go through these things and you start off with radiation, and then I had the first level of chemotherapy. And when you don't get a response from those things, when you find MRI after MRI that it's the same or getting worse, then you have a few dark moments and you go, oh, what is this going to look like? Will I live? And you certainly have those moments and you say, am I going to survive this? So you certainly get a period where you fear death. At the moment I'm doing reasonably well with treatment and I'm in a good place, but lying behind it is this thought that one day this might get you. So you fear that.